Yeah, it's a fair question about Kymriah, the new CAR T therapy from Novartis, and I've actually written about this a fair amount at this point. I think the drug has a price that is so high that it's actually a little bit hard to process. It's $500,000 for a single treatment. And we expect it only to be used once in each patient, and it may have a very long-term benefit for patients. Novartis is going to only ask for reimbursement for it when the drug achieves a response at 1 month. But it's the Institute for Clinical and Economic Review in Boston is going to do a full-scale evaluation of its price relative to other prices of drugs in the market and relative to the value it brings. And I'm actually would like to wait to see what they have to say because it's a very unusual drug, it's an unusual disease, the alternative treatments are very expensive, the way it's used, the type of outcomes we have, all make it very difficult to assess. But no, for sure the sticker shock is pretty alarming. They have broken through by a full log, essentially, traditional prices in cancer with that drug. And those prices often don't hold up to health economic assessment. They often tend to be very, very high already. Yeah, I think it's not really clear how things like CAR T therapies that cost $500,000 will be paid for. Who's going to take risk, if you will, during these periods where we're trying to figure out if the drug worked. Who's going to have ownership of the drug after it leaves the wholesaler, or in this case leaves the company, because all those issues, which are very sort of granular and boring, are actually going to be incredibly important when you're talking about this kind of money. But I think hospitals are going to have to look very seriously at the economics here because there's a lot of attendant costs. There's ancillary services that may be needed. If these drugs are given as an inpatient, there's no mechanism in place, at least on the government side, to pay for them at full cost. So this is going to be, I think there's a lot of issues that will need to be straightened out. Yeah, I think at least at launch, and I think Novartis must be saying things about this, not that I'm aware of, but they must have a plan in place about where the drugs will be used. But presumably they'll initially roll out in the places that were either sites of clinical trials or places that have full ability in hematopoietic stem cell transplantation.